This is an introduction to basic IV calculations, and we are going to start off with calculating milliliters per hour. We're going to focus here on typically IV fluids and not get into medications in this video. For IV fluids, you're typically going to be using a IV pump, which looks very different depending on the manufacturer, but they all do the same basic functions. There's typically some sort of keypad here. There's a place where the tubing can go down and through and off to your patient. And then there's parts where you can program, and you'll need to put usually the type of IV fluid or just a basic IV fluid identification. Then you're going to need to put the milliliters per hour, and then you're also going to usually put a total volume or some other indicator of how much you want to give your patient. So when we're calculating for these patients, we need two basic pieces of information. The first part is the total volume that's ordered for this patient. And the second part that we need is the time. Now, typically, this is ordered in milliliters and it's ordered by hour, but it can be ordered by minutes and it could be ordered liters by hour. Give a liter in 4 hours. So there are some variations on this, but typically you're looking for the volume over the time, and typically that's in the milliliters per hour format. So let's do some examples and show you how this works. Our first question is a patient that requires 1,000 milliliters, which we know is the same as a liter, of normal saline to infuse over 8 hours. Calculate the milliliters per hour for the IV pump. All right, so we are trying to find our answer in milliliters per hour. You can write it to the side like that. You can write it exactly up and down like a fraction, but you know that milliliters needs to be on top and hours needs to be on the bottom. Now let's look at our question again and pick out the key information. We see here that we are going to need 1,000 milliliters to give our patient. Now, typically a nurse is going to grab a liter bag of normal saline. Often those are stored on the unit or somewhere close by, so you can grab the correct solution or the correct fluid and the correct amount of that fluid. And then it's supposed to infuse over 8 hours. That means for the course of an 8-hour shift, let's just say 8 whole hours, that 1,000 milliliters will be given slowly and evenly over that 8 hours. In order to do it over the 8 hours, we need to figure out how much should we give each hour, and the pump will automatically evenly distribute that if we program it properly. So, as I mentioned before, our key pieces of information are volume, which we have right here, and then we also need time, which we have right there. So those are the two things that we need to look for. Then we can set up our equation. Our equation starts with volume because we know we're looking for milliliters on the top. We put volume there, and then we put the time on the bottom. 1,000 milliliters over 8 hours. And all we need to do in this case is simplify because we already have our milliliters per hour. We don't need to do anything else. So 1,000 milliliters divided by 8 hours is going to give us 125 milliliters per hour. And that's what we can program the pump at. Some students like to overcomplicate these sort of equations and add additional math, but if it's ordered in hours, there's nothing else that you need to do as long as you put the volume over the time. All right, moving on to our next question. A healthcare provider orders 500 milliliters of dextrose 5% in water, that's D5W for short, and it's to infuse over 4 hours. Calculate the milliliters per hour for the IV pump. All right, first things first, our two pieces of information. What are you looking for here? You could circle it. You're looking for volume that's ordered, and then you're also looking for the time that it's ordered over. You see here a 5%. Don't let that 5% confuse you like you need to do something with that number. You just need to look for the volume over the time. That 5% is referring to the amount of dextrose that's in that water in the IV bag. So you don't need to do anything with that number in this question. This question's just asking milliliters per hour. So let's set up our equation then. We have volume over time. The total volume that we're going to give is 500 milliliters, and we're going to give that over a total time of 4 hours. 500 divided by 4, and we get 125 5 again. Moving on to some additional practice, let's find our 2 key pieces of information. Here we have a patient that needs 750 milliliters of lactated Ringer solution to infuse over 6 hours. Calculate the milliliters per hour. All right, circle your 2 key pieces of information. You have 750 milliliters, and you need to give it over 6 hours. Let's set up our equation. 750 milliliters and 6 hours. Now we can just simplify. And 750 divided by 6 is also 125. You might be getting sick of these 125 milliliter per hour questions. They are not always the same like this. All right, our next question. A healthcare provider prescribes 1,000 milliliters of normal saline to infuse over 10 hours. Calculate milliliters per hour for an IV pump. Our key pieces of information we've identified here are what? 1,000 milliliters and 10 hours. All right, let's set up our equation. 1,000 milliliters is the total volume, and our total time is 10 hours. We will simplify that. 1,000 divided by 10 is 100 milliliters per hour. And we'll move right along to our final question. A patient requires 800 milliliters of dextrose 5% in water to infuse over 5 hours. Calculate the milliliters per hour for the IV pump. All right, key pieces of information: volume, time. Again, don't let that 5% confuse you. It's over 5 hours. If you are a visual learner, try to imagine that bag of IV fluid and how it would just slowly go in through the IV pump over that time. So let's start with our total volume, 800 milliliters, and our total time is 5 hours. We can simplify this, 800 divided by 5, and that is 160 milliliters per hour. Now that you've completed basic milliliters per hour questions, move forward, if you're ready, to intermittent IV, where the questions are sometimes ordered in minutes instead of hours. You also can try drops per minute, which is using tubing instead of an IV pump to deliver the medication or the IV fluid. These are all variations on this basic skill of calculating the milliliters per hour and will help you take your calculations to the next level.